Welcome to Mind Your Mental Health channel, a channel for mental health awareness, psychological health and well-being. We have done so far 23 episodes covering various aspects of mental health, and in the past few episodes we were talking about anxiety disorder. As a group, there are a number of anxiety disorders under the group of anxiety disorder. One is panic, generalized anxiety disorder, phobia. We talked about all these three disorders. In this episode, we are going to talk about post-traumatic stress disorder. This is also anxiety-related disorder, predominantly present with anxiety symptoms. And it is also more ideal to talk about post-traumatic stress disorder today, being 10th of October. 10th of October every year is observed as World Mental Health Day. And this year's theme for World Mental Health Day is access to services, mental health in catastrophe and emergencies. So PTSD or post-traumatic stress disorder is a very apt topic to discuss today, being the World Mental Health Day. So let's talk about post-traumatic stress disorder, or in abbreviation it's called as PTSD. The concept of post-traumatic stress disorder was there much earlier than the current days. As early as 1862, an American Civil War surgeon started talking about or observing certain psychological symptoms in soldiers who are fighting the war. And he said these symptoms occur relating to the war. And since then, a number of names were given to this collection of symptoms. One was Da Costa syndrome. They also called it as a soldier's heart because they thought it happens only in a war situation. Then during the World War I, a different terminology, shell shock, was used. You might have seen in movies or read books on World War I or seen some photographs. Mainly the World War I, the war method was fighting from the trenches. They dug the trenches and soldiers had to stand in the trenches away from the eyes of the enemy and then wait for an opportune moment to climb the trenches and then charge towards the enemy front line. But as they were standing in the trenches, they can see the bombs exploding all around them. And they can also see their colleagues, fellow soldiers, torn into pieces because of this bombardment. It's a very traumatic situation, ghastly to look at, and a very, very disturbing situation to go through. So when they go through these kind of a situation, they develop psychological problem. They develop psychological symptoms. So during World War I, they called it as shell shock. When we come to the World War II, the same symptoms, same kind of experiences in a different form, and that time they call it as a battle fatigue. Only in 1980s, the scientific community, the psychiatrists, psychologists started recognizing the disorder, post-traumatic stress disorder. Initially, it was again related to the war, mainly from the Vietnam War. When the Vietnam War veterans started coming back to United States, either during the war or after the war, they presented with a group of symptoms. And those were very pathognomonic of war-related trauma. And that was called as a post-traumatic stress disorder. In initial days, these symptoms were related only to war. They thought these were relating to war-like situations. Very unnatural, catastrophic, and severe, out of the normal life experiences like war or natural calamities like earthquake, flood, cyclone, those kind of things were related to the PTSD. Only when people go through those kind of situations or experiences, they develop PTSD. Later on, that concept slightly changed. They started including other experiences which could also provide these symptoms or which could also traumatize a person. So it depends on the trauma, it depends on the individual also, the psychology of that individual. A person can go through any kind of a trauma depending on the resilience they have, psychological makeup they have. So it is not only the trauma, it is a reaction of the person that is also very important. For person A, that trauma would be, okay, what is there? I mean, I have gone through that. Why is this person reacting? That kind of a thought will be there. But it depends on the person who is going through. He may not be the same person as the person who has gone through and then without a symptom. This person makeup could be, psychological makeup could be different, and that could trigger a PTSD symptoms. So that's why they expanded the concept of PTSD. Next is, what are the signs and symptoms of PTSD? There are a group of symptoms which are very specific to PTSD. There are also symptoms which is part of the anxiety symptom group. So they can have palpitation, they can have tremors, they can have sweating, perspiration, they can feel that their heart beats faster. All those things are symptoms of anxiety, which can also we see in post-traumatic stress disorder or PTSD. But there are certain symptoms which are specific to PTSD. These could be flashbacks, nightmares, hyperarousal, and hypervigilance, looking up all the time whether something is going to go wrong, or complete freeze, or failure to recall the event, or avoidance. These are some of the symptoms which is very specific to post-traumatic stress disorder. These symptoms can be grouped into three broad categories. One is re-experiencing the trauma. I have gone through a traumatic situation, and it is a very severe trauma which I have gone through. So one group of symptom is re-experiencing the trauma. I vividly re-experience, relive the trauma. What happened about 1 month ago? It will be very real for me, very vividly real for me. That can kindle all the anxiety symptoms which I experienced at the time of the trauma. These are called flashbacks, or living through that experience again. It can come once a day, many times a day. The frequency varies. So they go through everything, all the experiences, the psychological experience, what they experienced at the time of trauma, many times in the day-to-day life. Other important reliving experience is nightmares. They'll get a very vivid dream about that trauma. Probably it's an accident which they have gone through, or it's a rape which they have gone through. They relive in their dream. It will be very real for them. They might wake up from the dream, the nightmare, sweating and panicky, and then spend the rest of the night very, very disturbed and anxious way. This is one group of symptom. The next group of symptom is hyperarousal. I've used this when I described about the anxiety symptoms in 1 or 2 episodes. Hyperarousal is they are aroused. They are always looking for any danger, any trauma again occurring. A rape victim can be very, very hyperaroused, and the trauma reminds them again and again. They get reminded about the trauma again and again. That leads to hypervigilance. They'll be looking around. Now, if they go alone somewhere, they might be hypervigilant about who is going to attack me, who is going to sexually attack me, or if I had an accident, how the next accident is going to happen. So the hypervigilance and hyperarousal. When we have hyperarousal, particular nervous system in our brain, in our nervous system, gets activated more than the normal situation. That can lead to tremulousness, tremors, whole body can shake. I have seen patients, PTSD patient coming in with shaking and coming in. As they walk, they shake. Head to foot will be shaking. Now that kind of a fear they have, that is hyperarousal. Then the third group of symptom is avoidance. Naturally, they will like to avoid the whole situation. So avoidance behavior will come in. They avoid the situation which even slightly reminds them about the trauma. A person got mugged in a particular high street, particular part of the high street. And that experience was very traumatic. He sustained injury, fractures. And now they will avoid going to the high street, any high street. They might generalize it. Because going into the high street or even thinking about going into the high street raises the anxiety, brings in all the hyperarousal, re-experiencing of the trauma. So they avoid. Avoidance behavior is one of the symptoms we see. Sometimes they can also have emotional numbing. They feel as if they are not feeling anything. They have a numb feeling. The whole body has gone numb. So these are all the symptoms of PTSD. So to define further, this develops following an extremely threatening or horrific life event or series of events. It need not be one event. It could be one event or number of events. Now, we have seen patients having symptoms after a number of rape incidences. Now, unfortunate life events can occur repeatedly in a different life situation. That can also lead to PTSD. So, re-experiencing the trauma, as I said earlier, and very intrusive memories will come. They don't want this memories. They don't want these visuals, which is coming back to me, like what we call flashbacks. But they don't want it, but it will come back. It will intrude into their consciousness. So they don't have a control over that. And that induces intense fear and horrific experiences. And also all this, the physical sensations. They also persistently perceive heightened current threat. So what I mean is, the perception about any event can be heightened with the current threat. They might feel that currently I'm going to go through this threatening situation. That leads on to hypervigilance. With that, they can also have other symptoms like insomnia. They can have problem in falling asleep. They might go to bed around 10 o'clock. That is the usual bedtime for them. But they might lie down in the bed, they won't be able to sleep. All the anxiety thoughts will come. All the negative thoughts will come. Anxiety about next day will come. So they'll keep thinking about it, thinking about all the trauma they have. So they have a difficulty in falling asleep, or they have difficulty in staying in sleep, continuing the sleep because of the nightmares. They might go to bed around 10 o'clock. They might have difficulty in falling asleep for some time. Then they go to sleep, they fall asleep. And then in an hour or two, they get up with a nightmare. They'll experience nightmare and get up. Then they won't be able to sleep. And their mood, their tolerance comes down. They become very irritable. And they can have outbursts of anger because they might think others are not understanding me. They think I'm over-exaggerating things. They might say that I've gone through the same situation. Why are you reacting? All those things can make them very angry because the other person cannot understand what they are going through. It's a psychological suffering. And they might have difficulty in concentrating. You might talk to them, but that mind will be with their trauma, what they've experienced. They may not take in information what you give. They cannot read a book because they can't focus and concentrate on passages. And they can have an exaggerated startle response. Startle response is sudden movement like this. When you hear a noise, you can commonly see in child, newborn, young children have this startle response. It is one of the primitive response nature has given as a protective mechanism, but it comes back in a PTSD patient as a symptom. So even slightest sound, they will startle. Now a war veteran, now when he hears a loud noise somewhere in the next street or in the street or the next house, you might be reminded of the explosion of the bomb. So that can lead to startle reaction and hypervigilance. These are all the symptoms of PTSD. Okay, so let's see how common is this problem. It is more common in war veterans and war soldiers, obviously because of the experience they go through. Some of the studies have pointed out that 8% of the United Nations peacekeeping forces, wherever they are, Somalia, Afghanistan, whichever area they are, they go through PTSD symptoms. 8% of them, 8 to 10% of them. About 30% of the civilian can also go through same symptoms, PTSD symptom, in war zones. A soldier experiencing a symptom in a war zone and a civilian who is not prepared for this kind of a situation, not prepared psychologically and training wise for a war-like situation, will have a 30% now. So those civilians in the war zone, in the periphery of the war zone, can also experience PTSD, and the research says about 30% of them will experience severe PTSD. When we come to the general population, then about, they say about 5% of the men and double the amount, 10% of the women experience PTSD symptoms. For many reasons, women experience almost about double the percentage of men. So 5% in men and 10% in women. So some of the explanation given is men may not come out and talk about their symptom, or it could be cultural, or other factor is women are able to express themselves more often. This could be the reason why we see more in women than men. But there could be other reason also. The psychological development, psychological factors can also contribute to women having more PTSD symptom than men. The next question will be, what causes this? What are the reasons? Now, as I said in many of the earlier episodes, psychological disorders caused by multifactorial causes. There are many causes. One is neurotransmitters. Our whole behavior, thinking, everything is modulated by neurotransmitters. There are a number of neurotransmitters. Now, dopamine, serotonin, GABA, there are a number of transmitters. Imbalance of that can lead to anxiety symptoms. That is one. Other one is gene. I have already said that about this. I've already mentioned about this in the previous episodes. People can have a propensity to develop a disorder. That means a father has a disorder, son or daughter might have a propensity to develop disorder, but they need not develop the disorder. Not that father has, son should have it. Son can develop depending on the situation, depending on the contributing factors. So the biochemistry or neurotransmitter and genes can contribute. That's why sometimes we see in families the PTSD. And there are a number of psychological factors, psychological causes why people can develop a PTSD. Person A doesn't develop PTSD in the same situation. Person B develop PTSD. So that's where we need to find out why it is happening. So psychological factors. Now, one of the psychological theory is it's a learned behavior. They try to explain with a behavioral concept. I have done an episode on behaviorism or behavioral concept. Now you can go back to our playlist and then have a look at it. So, where the person gets conditioned to a fear situation, somebody assaulted me, and that assault is a conditioned response, a conditioned stimuli that has produced the response in me, the fear response in me. So same response can be transferred to neighborhood area. Neighborhood area means anywhere in the high street I might fear. I might experience the same symptoms when I go to the high street. So instead of one person assaulting me, instead of that one person, I generalize it to the whole high street. That is one explanation. Other explanation is kind of a cognitively. And catastrophizing thinking can come in. They might catastrophize even small things. They might generalize everything. Worst thing is going to happen. So these are some of the psychological explanations. And what are the risk factors? Risk factors before the onset of the illness, pre-morbid, what we call pre-morbidly, if there is early separation from the parental or early separation in childhood, can indicate or can be a risk for developing future PTSD symptoms. And family history of PTSD or family history of generalized anxiety disorder lead to PTSD in a later life, depending on the situation at that particular point in time. Now, other risk factors are childhood abuse. Going through traumatic emotional childhood abuse, sexual abuse can lead to PTSD. That's why we see, quite commonly we see, when I'll talk about in detail when you see personality disorder, especially a particular personality disorder called emotionally unstable personality disorder. Many times these personality disorder persons would have gone through childhood trauma, usually sexual abuse or physical abuse. They can also develop PTSD symptom in addition to personality disorder. So childhood abuses and combat zone. Now when they go for a war, any war situation is an abnormal situation, can induce PTSD in a vulnerable person. Domestic violence is another common cause for PTSD. Domestic violence is under-remoted in many countries. Now there are countries, they have put in a lot of measures where they are able to identify domestic violence and awareness created to report about domestic violence. So domestic violence is another contributing factor for developing PTSD. Road traffic accident is another common. Very severe road traffic accidents can lead to PTSD. And all these situations, what I have listed, should be overwhelming and uncontrollable. Now that's another criteria what we look for. Overwhelming and uncontrollable situation can lead to PTSD. What are the comorbid problems? When we say comorbid, co-occurring disturbances in a PTSD patient. A person can have generalized anxiety disorder with or without panic disorder. So panic disorder becomes comorbid illness. So comorbid or co-occurring problems are sleep disturbance. I already discussed about it, what kind of a sleep disturbance they have, insomnia. Yeah. Then they can develop depression. Now because PTSD can go on for a long time. Now so that can lead to a lot of problem in life and ability to cope with the day-to-day life. All those things can add on to suffering and lead to depression. Anxiety symptom, they can have intense ongoing anxiety symptoms. And another maladaptive coping behavior is taking on to alcohol or drugs, which can kind of give an illusion as if they are getting better or the symptoms are elevated under the influence of alcohol when they are intoxicated. That is not the right fact, because the symptom remains the same, the problem remains the same. We only mask it momentarily with alcohol or drug, and when that is gone, the alcohol effect is gone, it will rebound with more severe symptoms. So substance misuse or alcohol is not a solution to any PTSD problem. And it can also lead to impairment of social functioning and work functioning and family functioning. So it can affect the work, family and social functioning. All this can add to or compound the problem associated with PTSD. In recent times, we also started talking about complex PTSD. So we are trying to differentiate between PTSD and complex PTSD. Complex PTSD, where PTSD symptoms last for longer, leads on to worthlessness, hopelessness, shame and guilt, and problem in controlling their emotions, angry outbursts, behavioral problem associated with anger, and find hard to connect with people. Now, a person who was very extrovert, joking and enjoying life, going to parties, withdraw. They are not able to connect with people emotionally. They are not able to vibe with people. Those things can be part of PTSD. And this can lead to relationship problem. The relationship problem between husband and wife, or between the friends or partners, any relationship can be impaired because of these connection problems. So these are all, we call it as a complex PTSD. Complex PTSD are more associated with childhood abuse or neglect, severe neglect or severe abuse, domestic violence, again very severe some domestic violence or number of domestic violences, sexual abuse, rape, sexual assault, and torture, sex trafficking, and slavery. Slavery in any form. It could be economical reason, financial reason, or sexual reason. There are many reasons why a person can go through slavery. These can also lead to complex PTSD, because it's going to be, if you look at the list what I'm giving you, it could be continuous. Domestic violence goes on for some time before it surfaces, comes to attention of either mental health professionals or social services. So a person is locked into a situation where they're not able to escape, but they continuously go through almost every day. This can lead to complex PTSD. War, of course, war is not going to be one day affair. Even though it might start as a one-day affair, the warring groups might say, I'm going to finish it off in 1 month, but it'll continue for years. We have seen that many occasions, many war theaters, we have seen that. So war, again, locked in situation, continuous trauma. And experiencing trauma and very young age can also lead to complex PTSD, because the psychological differences haven't been developed fully. At that age, they're going through this trauma can leave a very, very strong mark on the person's psyche. And another important factor is for complex PTSD is when I am trusting someone. When I have a confidence in that person, now I believe that person, and that person goes against and causes a trauma to me. It could be sexual trauma, it could be neglect, it could be anything. That is a very, very disturbing situation, because I trusted in this person. That trust is gone now. And I will generalize that. I will not believe anyone then. So that can lead to complex PTSD. And as I said earlier, when you are not able to escape from the trauma, escape from that situation, war situation, or slavery, sex trafficking, where you have somebody controlling you all the time, or child abuse. As a child, you can't get away from the domestic situation which is abusing you sexually or neglecting you. These situations can also lead to complex PTSD. So next question, logical question will be, how do we treat them? It's a very disabling condition in a severe form. It can be very, very painful condition also. When I say painful, I'm talking about psychological pain. In recent times, we have identified a couple of therapies which has evidence base. When I say evidence base, what I mean is the research has gone through. They have researched on this particular therapy and proved to be very effective. That's what when we say evidence base is. So one is trauma-focused CBT, cognitive behavior therapy. You might hear this word repeatedly when we talk about treatment, because one of the very effective, evidence-based, effective treatment in psychiatry or in psychological problems. So, but here the CBT is focused on trauma. So that's why it's called trauma-focused CBT. So that is one of the effective treatment. Another therapy is EMDR. It's an abbreviation, EMDR. EMDR stands for eye movement desensitization reprocessing therapy. So this is another very effective treatment, more effective in single episode trauma. Suppose there is a trauma, let's say one episode of assault leading to severe physical injuries, all those things, or one episode of severe traumatic sexual assault or a rape. It's more effective, but it is also effective in other multiple conditions also. And other than these two therapies, relaxation trainings can help and breathing techniques can help. And medication, of course, medication does play a major role, especially in preparing a patient for a therapy. Now, medication can bring down the anxiety symptoms, and we use a number of medications, mostly antidepressants. They belong to a group called SSRI and SNRI. These two groups are effective in treating anxiety symptoms, so that's why it's used here. SSRI are more effective. And in a very severe case, we might also add a small dose of antipsychotic medication to enhance the effect of the SSRI and SNRI. So these are all medications which we use to manage PTSD. So in this episode, we discuss about PTSD, the concept behind the PTSD, some historical facts about the PTSD, and signs and symptoms, and then causes and the prevalent rate, and in the end we also talked about treatment. Thank you for being with us. Thank you for your support. Do subscribe to our channel. If you think it is helpful to others, you can share it to your friends and relatives. And we also welcome comments.